I'm behind the scenes doing that right now. We're so excited that you guys are joining us again. We're back for another week of our diabetes reversal webinar. We have Dr. Scott Saunders is here.
Hi, it's me.
Leslie. Yeah. Hi, it's me. My name is Leslie. I'm here each week, and we're excited to chat with you guys. So let me go ahead and put this on Facebook. If you have anything you want to share, Dr. Saunders, go right ahead.
Well, today our topic is joint pain, because joint pain is so common to have with diabetes, and it's not a single entity. It's a lot of different entities. So that's why we want to talk about it. And one of the important things that we always say is the webinar is for informational purposes. It's not for you to say, oh, Dr. Saunders told me to do this, because you have to apply each thing to your situation. Say, does that fit for me? Is that the right thing for me? And that's where you work with your doctor. And when we say, oh, you may not need that medication, or that medication can cause these side effects, and you go, oh my gosh, I'm having these side effects, I better stop the medication. Wait, talk to your doctor first and say, look, I'm having these side effects. Because the doctor may say, oh, it might be this other medication or something else too. So you have to apply everything to your specific situation and see it if it applies.
That is good. All right, we're live on Facebook. So Facebook friends, say hello. One of the things that we want to do right away when we begin, guys, is we want to take some of your questions. So we always open up these webinars to hear from you guys. And so typically we do that toward the end, but we want to go ahead and answer some questions right away here in the beginning. So feel free, if you're on Zoom, go ahead and type those questions in the Q&A, and we will get to those. On Facebook, go ahead and post in the comments. If you have any questions about type 2 diabetes, we would love to answer those. And often other questions come from that as well. So let's start there. Or even joint pain. If you're experiencing joint pain or you know someone who is, ask us questions, let us know what's going on. Dr. Saunders is full of information and would love to chat about those things with you guys. So
it's in my head. It's in my head.
Okay, we have Patrick on. Hi, Patrick. Let's see. Post those questions, you guys. We're excited to hear from you. Joe is not with us today. But it's okay. We have the doctor, so I think we're going to be all right. We're going to leave to do the webinar. Then you would have been in trouble.
The doctor is in. So if I can get started with joint pain.
That was his name last week.
Yeah, that's right, huh? So if I can get started with joint pain is the most common side effect of any kind of inflammation, anything that's going on in your body that's wrong. There's a measure called CRP, C-reactive protein, that is a marker for inflammation, but it's not just inflammation, it's actually cellular distress. So even if it's not inflammatory, there's still cellular distress, and that's why some people have terrible joint pain, and they're going like, oh man, my shoulder's killing me. And then they do tests, and the doctor says, no, you don't have arthritis, you're fine. All the tests come back normal. And your inflammatory markers are normal, and everything's normal, and you're going, what the heck? It hurts. And so that's where we can start. So I'm going to start with a story, if you don't mind. And it is a story of a friend of mine who came to me, and his name is Mark. And Mark said, Scott, can I ask you a question? This has just been bugging me for months. It's been more than 6 months. And my right shoulder's killing me. And he says, I drive for Uber, and it's really hard to drive, and I can't hardly steer the wheel because I can't lift my arm up. And so I'm kind of pulling with one hand, and it's just hard to put my shirts on and everything because my shoulder hurts so much. And I asked him a lot of questions. Does it come and go? Yeah, it comes and goes. It kind of feels like it's going to get better, and then it gets worse again. I said, did you ever injure it? Fall on it? Do some kind of injury to it? Lift like 300 pounds? No, I never do stuff like that. And I just started hurting out of nowhere for no reason. And I'm like, really? So generally, there's only one thing that can cause that kind of pain, something that comes and goes, waxes and wanes, but doesn't go away in a long period of time, and there's no inflammation. That is blood flow. If you're not getting blood flow to a joint or a part of the body, then you're getting hypoxic, low oxygen, and the muscles and tendons and nerves start screaming for, hey, we don't have enough energy here. This is not working well for us, and we need help. We need energy. We need oxygen, and you build up like lactic acid in the tissues, and that lactic acid causes the soreness that you feel after you've been working out, pumping weights or something. So that pain shows up, and it's kind of constant, but sort of gets a little better and then worse, better and worse, because as you have more constriction of your blood vessels, you have less blood flow and you get more pain. And then as the blood vessels open up, then it cleans out the lactic acid and you're feeling better. And it starts to go away. So I asked him about it. Well, what about blood flow? Do you have any issues there? Do you have any like thyroid problems or circulatory problems? And no, I've never had anything like that. He's pretty active and does stuff. And sorry. Then, so we looked into other things. So there was a doctor named John Sarno, M.D., and he wrote a series of books called Healing Back Pain, Mind Over Back Pain, The Divided Mind. And it's all about something called tension myositis syndrome, TMS. And this TMS is where the blood flow is diminished to a part of the body, and very often it's the lower back, by the brain. And the brain causes that to happen in order to bring attention to something. There's a problem, and nobody's addressing the problem. And so the brain creates a physical pain to demonstrate an emotional problem that everybody's sweeping under the rug. By everybody meaning all your cells, you're as an individual, and so then we started discussing this a little bit, and we looked up in a book by Louise Hay called Heal Your Body, and she has a list of things, of parts of the body where the brain would manifest it in the shoulder because it's a loss, and in the hips because it's a fear, and in the back because it's a loss of support or a support issue or something like that. And so we looked up shoulder loss, left shoulder, right shoulder's loss of power because that's your power arm, left shoulder's loss of support because that's your support arm. And I said, okay, so does this apply to you? Again, that same thing we were just talking about. Does this apply to you? He goes, are you kidding? That's exactly what I've been dealing with. I lost my job over a year ago. I tried getting another job. I have not been able to get another job. I'm driving for Uber just to make some money. It does not make ends meet. My wife is essentially supporting the family, and it's really, really hard. And so I feel like I'm powerless to do anything. He's a foreign national, and so it's not easy for him to just, go out and get a job easily in his profession. So I said, okay, go deal with that. And you know what he did? He met a bookkeeper who said, gee, I really need help. So he got certified in QuickBooks, started being a bookkeeper, got a whole bunch of clients. I saw him several weeks later. This is only weeks now. 0 shoulder pain, gone. Shoulder pain gone. After months and months and months of pain, the shoulder pain was gone. So now I got to end my story with me. So I'm like, dang, that's amazing. I didn't expect that so fast. So I go, you know what? My shoulder has been killing, my left shoulder has been killing me for a long time. And it's the same kind of thing. I have to put my shirts on this shoulder first, then I can reach around and do that one. And I couldn't reach up with this hand to get my robe off the hook. I had to use this hand, those kinds of just daily kinds of things that I would make allowances for my pain, my shoulder pain. And so I started thinking about, okay, right shoulder loss of support. I started going through my life. I got a divorce. Maybe that's it. It's that. Maybe my children have all left home, and they're all out in college and gone, and I lost that support. No, not really. And then I got remarried. That's, it's hard, change in any way. But then my wife has a house in Utah. So she's living in Utah. I'm living in California. So we're like 3 states away all the time. And for me, that was really hard. I lost my support. My emotional support was gone. And so I thought, well, either I'm going to have to leave California or she's going to have to come to California or something in order for me to get rid of this pain. But then I was reading a book, and the book was about how human beings, all of us, have to deal with our aloneness, the fact that we are alone, the fact our reality of loneliness. And so people often, they get depressed because even though they have, 200 close friends, they still feel in their heart, they still feel alone. And they still have a lonely sense of not knowing who they are or where they fit or whatever, having that. So I thought, well, instead of dealing with the symptom, the overlying issue, why don't I deal with the underlying issue of my own loneliness? And I started praying about it and thinking about it and managing it, reading books and counseling. And literally within weeks, my left shoulder pain, within 1 week, it was better, but within several weeks, it was gone completely. After months of just dealing with shoulder pain. So I want to emphasize that, because if you're dealing with chronic pain, look at maybe underlying reasons for it, especially if you find out that you don't have inflammation and it's not an inflammatory condition. Even if you have like rotator cuff tears and knee, I was just reading a study they did on knees. People who have arthroscopic surgery on knees are no more likely to get better than people who if the surgeon just cuts the knee and stitches it up, you get the exact same benefit as if the surgeon goes in there with an arthroscope and cleans everything out and cuts your meniscus and does all the things that surgeons do. There is no difference in the long run of whether you're going to get better or not. Okay, so think about that. Even if you have some derangement of your knee or some, rotator cuff tear or blah, 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 you still may have to deal with this circulation issue, because if you don't, it won't heal. So that's why people, they go, oh, I'm on my 3rd shoulder surgery, I'm on my 6th knee surgery, I'm on my 5th back surgery. And I've seen these cases. You've got to deal with the underlying problem, or else your surgery is not even going to heal properly and you're going to end up in the same place.
Wow. Healing the whole body. I love this. Tell me again the name of the book that you were talking about. I think Heal Your Body. Is that what it was called?
Yeah, that was the Louise Hay book. And that's the one that had the if you have neck pain, it usually means I don't know, something, and then it means something else if it's like middle back or lower back, or that's it was just interesting I'd read that book years before, and so I looked it up, and it's an old book. It's been around for a long time.
Wow, that is awesome. Okay. We're starting to get some questions too. So let's go ahead and just let's answer one of these questions. We have one from Grace. She says, during this COVID lockdown, I have developed arthritis in my thumb, the hand that uses the mouse, which I use a lot. It may be related to carpal tunnel. And she's asking that as a question.
Okay. Thank you. That's a beautiful question. So overuse injuries. Overuse is real. It's not something that is just made up. But why is it that two people doing the same thing, one gets an overuse injury and the other one doesn't? The reason for that is because one of them isn't healing very well. So we have 2 different types of metabolism. And we've discussed this before. You have the anabolic metabolism, which is what you're rebuilding, and the catabolic metabolism when you're breaking down. So when you're awake and alert and doing things, you are breaking down your tissues, you're breaking down your body, you're breaking down your joints, you're using things. It's just like driving a car. It's no different. If you're driving your car and you're super careful, you're like, you only go 20 miles an hour, and you slow down carefully at every stop, and you don't step on the gas, you gotta gradually build up, and you're just a super careful driver, guess what? You're still breaking down your car. Yeah, it's not as much, but you're still breaking down your car. Just anytime the engine's running, you're creating heat in the engine and you're wearing it out. You're sitting in the seat, you're wearing the seats out. The tires are rolling and they're leaving the rubber on the road. You know, there's no way around. If you're driving your car, you're breaking it down. Well, the body's the same way. But what we have that a car doesn't is we have an anabolic metabolism. Every night we get to rebuild that. Okay, so now two things come into play. The first one I'm going to talk about is the rebuilding, and that is our 610 reset program. And if Leslie can put on a link, we have a 610 reset program, and what that is that's how you get into anabolic mode every night. If you don't make the human growth hormone in that spike, 10-minute spike is all you get between 10 p.m. and 12 p.m. If you go to bed too late, then you may not get it at all, and you may not start rebuilding. You won't make you may not make human growth hormone, you may not rebuild your body. But human growth hormone initiates it, but all the other anabolic hormones come in, like testosterone and estrogen, and insulin-like growth factor 1, and all of these hormones, then all of your joints, they start repairing, they start fixing, and it's amazing. You rebuild, repair all night long. And so the car doesn't have that. Your car is going to wear out, but your body doesn't have to. That's the cool thing about the anabolic metabolism. So 610 reset is one. Number two is the one I spoke about first. If you have some issue and that you're not getting enough blood flow to an area, even when you're anabolic, you're not going to rebuild because there's not enough blood to get there to rebuild and to clean out everything out, because you have constricted blood flow and there's not enough blood getting through those arterioles. So, so you may have to deal with the specifics of why your wrist is a problem, your thumb is a problem, why that joint. That's a common issue. There are other issues, by the way, but those are the first two to deal with. The next is inflammation. If you have inflammation in more than one joint, if it's all over or moves around or something like that, you might consider looking at degenerative joint disease, DJD. And that is where you're gradually wearing out. Like the 610 reset helps that, but you also have to have the building blocks. So food is a big one for this. And getting enough protein, getting the right kind of carbohydrates, glucosamine is really important. A lot of people take supplements. And I've had a lot of my patients say, you know, they went on a glucosamine, MSM, and vitamin C regimen. It's 500 milligrams 3 times a day of each. Now, studies have been done where people always ask, well, can I just do it all together at once and take the 1,500 milligrams? It turns out that doesn't work as well. That actually you probably need the 500 milligrams 3 times a day with meals of glucosamine 500, MSM 500, and vitamin C 500. And that's a great formula for joints to rebuild or to give the building blocks so that you can repair the joints. Then do the 610 reset program, and then you can repair because you'll have all the materials you need. All the, you know, if you get a whole bunch of guys together to build a house, but somebody forgot to order the wood, then those guys are just going to be milling around with nothing to do because they can't build the house. In the same sense, your joints can't rebuild if you don't have the building blocks. So adding that in might be really helpful. 610 reset. Think about your emotional issues associated with joint pain. You know, carpal tunnel was mentioned just now. Carpal tunnel is not a problem with the nerve. It is a problem with the tendons. It's tendinitis, actually. The tendons have a sheath around them, and that sheath gets swollen because of inflammation in the area from like overuse or something, that doing all of this stuff. There's a tunnel going between. There's 7 bones in the wrist, and there's a tunnel through the middle of those bones, but there's no space in there. You get this much space and nothing else. And once they take up all the space, there's a nerve going with them, and they squeeze the nerve in that tunnel because they swell, the tendons swell so much they squeeze the nerve, and that's where the problem lies. So what the surgeons do is they cut this, what holds the bones together, retinaculum. They cut it, a ligament, to allow the bones to open up to offer more space. But that doesn't fix the problem, because you still have these swollen tendons. What if they swelled up more? Then you get your median nerve messed up again. So you still have to fix the problem, even when you have surgery, even when you do something else. Wow. Boy, that was a very long answer for a short question, but I hope a lot of people got information from that.
Yes, it was really good, because I know that Krish asked a question regarding that. Let's see. So do all of the knee, back, and shoulder, all of the knee, back, and shoulder pain are caused by blood circulation issues then?
Okay. The answer to that is no.
Yeah.
That's one cause that you have to look at. So remember when I went with Mark and I asked him all those questions, did you injure it? Well, no. Did you have, let's see. Oh, do you have inflammation? No. What's the course of the illness? Is it like it suddenly came on and it's staying the same, or is it getting better and worse? All of those just gave me a lot of clues to the fact that this was a circulation problem, because circulation problems get better and worse and better and worse over a long period of time. Whereas things like rheumatoid arthritis, it's like, it's always bad. You wake up stiff every morning, and it's not something that improves significantly over time where you think it's going to get better. Your joints just get worse and worse, and gets so he gave me the clues to tell me it was a circulation problem. I didn't do any tests on him, but I could have just as well have done a bunch of tests on inflammatory markers and said, oh no, you don't have any inflammatory markers. That's not to mean there's nothing wrong. That's just to say it's not an inflammatory process, which means it's probably circulation. So there's other ways to look at that, but thank you for asking that question. No, everything is not that. People really do have slip discs in their back and compressed nerves and need surgery on it. About 80% of surgeries are unnecessary, but 20% of them are necessary and really work and really do good.
Okay, that's good. Can you talk a little bit more about glucosamine? We hear about it a lot. What is it?
Oh, that's an interesting question. It is an amine. It's a sugar amine. It's glucose with an amine on it. So you've heard of amino acids? Amino acids are what builds that's the building blocks of all our proteins. Glucosamine is a building block, and the reason that amine has to be on there is so that they can attach together and polymerize. And so it makes these long polymers, glycosaminoglycans, they're called, that make up our cartilage and the oil that greases our joints. If any of you have ever had Synvisc, which is an injection that orthopedic surgeons put into joints when it is bone on bone. Synvisc is a viscous glycosaminoglycans that replaces that grease that we have in our joints. And if any of you have ever seen a ganglion cyst, that they come commonly in the wrist, and the doctor has sucked the cyst, the fluid out of the cyst with a needle, and you look inside the syringe, and it's got that real thick like jello in it. That's what oils our joints. It's literally like grease, but it's a glucose. It's a carbohydrate grease, and not a petroleum type grease. And it works really well. And some people don't make very much of it and don't make it very well for a lot of reasons, one of which is not having enough glucosamine. So when you add the glucosamine in there, then you go, wow, I can make that joint again. I'm moving nicely.
Okay, this is good. Um, there was another question. This is interesting. You know, when I go to the chiropractor, if I have lower back pain, he often checks to see if your bowels are full. And so the question here is, I know Chris has a friend who tells him when he gets back pain, it's usually related to having gas problems. And so once the gas is expelled, that pain goes away.
Okay, Krish, we'll help you with this. I know your friend has it, but um, sometimes if there's some kind of irritation in the lumbar region in the area, you may feel pain in the back. If it's in the intestines, you'll feel the pain in the front. But if it's called retroperitoneal, if it's behind the bag that the intestines are in, which could include the colon or the distal, the rectum, actually, you can actually get back pain, and it can be pretty bad back pain from the distension of that retroperitoneal area. And then as soon as you pass the gas, then it's gone because the pressure's gone, and that's a pressure thing.
Okay, here's another good question. These are awesome, guys. Keep asking questions. We love to hear from you. This is from Krish as well. Let's see. There was a media report yesterday that adult stem cell therapy would help COVID-19 patients. If this is true, I think this could be potentially a game changer. Could you comment on this further? Thanks.
Oh, I wish I had read that to be able to talk about it intelligently. But I'll give you an opinion anyway. So far, the majority of things this adult stem cell therapy is supposed to help is not nearly as good as the research on animals was saying it should be. And we had a whole program. Go back and look at our program on stem cell therapy and how you need to become anabolic in order to release stem cells and help stem cells to work. And so now specifically for the COVID-19 thing, this virus is a coronavirus that attaches to a specific receptor called ACE2, angiotensin converting enzyme 2. So it binds to this receptor. So why don't children get this illness? Or if they do, it's like a very mild illness. Well, they have very little ACE2. They just don't make very much of it. As we get older, we make more. And then people who are taking high blood pressure medications make 5 times more than other adults. So you have this gradation. And so the number one comorbid condition, the number one condition of people who are hospitalized with COVID-19 is hypertension. So you have this sort of gradation. So there are also these receptors in the pancreas. So if the virus gets in and binds to the ones in the pancreas, then you could possibly get diabetes from it. If it binds to the ones in your heart, then you could have heart disease, like congestive heart failure from a viral myocarditis, it's called. You can get encephalitis. You can get, and wherever those receptors are for the virus, if the virus gets there, it could cause that specific tissue to be a problem. Now, how do stem cells help? Well, if you have myocarditis, for example, they can put stem cells into the arteries of your heart that are going into the muscles and repair all the damage that's been done by the virus. So, so to answer your question, yes, it's possible. But whether that's going to be just injected into your veins and see what happens, I don't know. That's what most people are doing with stem cells, and I haven't seen any results from that yet.
Okay, going back to talking about the supplements, the glucosamine, MSM, and vitamin C. What is MSM?
Oh, it's methyl sulfonyl methane. So one of the limiting factors in our body is sulfur. And what's amazing about that is sulfur is abundant. It's everywhere. You can't avoid sulfur. There's just a ton of sulfur everywhere. But that yellow rock or that yellow powder that you see, that's the brimstone sulfur, is useless to our bodies. it has to be bound organically in order for us to use it. And we don't have any way of assimilating that kind of sulfur. So where do you get sulfur? Well, there's sulfur amino acids. So if you've ever smelled a rotten egg and you go, ugh, that smells like sulfur. Yeah, that's what it is. If you've ever smelled gas, when people pass gas out their rectum, and there's often a sulfur smell, that's the sulfur. Sulfur, most of the sulfur compounds are volatile, which means they go up into the atmosphere and they're not used very long. So think about something like fresh vegetables. If you go out in the garden, you pick your fresh vegetables and you eat them, there's sulfur compounds in there that you're getting that are very useful for your body. If those same vegetables sit in a refrigerated railroad car for weeks going across the United States or something, then though the sulfur compounds are dissipating into the environment, so you're getting less, not none, just less. And so we rely heavily on our sulfur proteins like cysteine, but cysteine is not a really common sulfur protein. So unless you're eating protein foods, then you may not be getting a lot of that. So that's a very long way of saying, how are you going to get sulfur? It's really hard to get. Well, a long time ago, well, not that long ago, less than 100 years ago, there was a paper mill in, I think it was Georgia, and the deer there, they found their deer hides were awesome. They were real thick, heavy, good quality deer hides. And so someone said, why are the deer hides in this area, this area around this paper mill, so good compared to the deer hides outside of that area? And so someone did research and found out that there was a sulfur compound called DMSO, dimethyl sulfoxide, which is used as a solvent. And that was in the water, and the deer are drinking the water and they're getting this sulfur, and it's making their deer hides just awesome. So then they started doing research and found out, gee, you know, in order to make cross links for our collagen fibers, in order to link the collagen fibers together and make them strong, these fibers require sulfur. So they're disulfide bonds that hold them together and make them super strong. So they started doing research on that with humans, and they found, oh my gosh, look at this, how much better people's joints are and their skin, and everything looks better when they get this extra sulfur. Well, DMSO is kind of foul smelling, kind of like rotten eggs. It's kind of like a cross between garlic and rubber. And a lot of people don't like it, although it'll absorb into your skin really well. Some people use it and they just put it on their skin a little bit, and absorbs right through the skin and goes into the blood.
And then they never go in public, or they never are around other people after that, or what?
You know what? They smell, and it smells, and it really.
I think there's some famous people who, you know, do lots of crazy things and don't wear deodorant and that kind of stuff, and they're okay with it. So you do you, I guess.
You never know. So anyway, then the MSM comes out, which is also a sulfur compound, readily available to the body. It is benign. You can just like have a cup full of it, and the body will use what it needs and then get rid of the rest with that. It's non-toxic in any amount, but it turns out that about 1,500 milligrams a day seems to make a big difference, and adding it 5 times a day or 3 times a day, 500 milligrams 3 times a day is really good.
Okay, and then this came up, let's see, I think the question, I gotta find it, was asking, I believe, about glucosamine. All of these vitamins are safe for diabetics, correct?
Oh, totally. In fact, every diabetic should be taking them anyway, because just to have the building blocks so you can rebuild tissue.
And they don't affect blood sugar levels, I think was the question.
Oh, yeah. Yeah, somebody said that glucosamine should affect blood sugar levels, but it doesn't.
Okay.
No,
okay.
It's good. Yeah.
All right.
Because it is glucose.
Yeah.
It is a sugar. Yeah.
Okay.
But it's not an energy sugar, so it's okay.
Here's a question from Teresa. It says, please speak to chondroitin. Are you familiar with that?
Yes, yes.
Okay.
Chondroitin is it actually can be very helpful as well. Um, let's see, things like shrimp, um, things that have exoskeletons like bugs, they, instead of making bones like we have, they use a chondroitin. They use a protein carbohydrate substance that makes up their skeleton, their outer skeleton. What holds them together is this, what makes their shells and everything is this chondroitin. And so you can buy that. You can buy it boiled down. I don't know where they get it. I think they're getting it from like shrimp tails and all that kind of stuff. But it actually does help the chondrocytes, which make the cartilage in your joints. It gives them building blocks also. Chondroitin can be very helpful for some people, and actually for most joint formulas you can add that onto the list. There's a lot of other like the shark cartilage stuff, when I drink bone broth, you're getting essentially that same materials for building blocks of your joints when you're making soups and broths and stuff like that out of bones.
Okay. This is good. For those of you who may be joining us for the first time and you're liking what you're hearing and what you're learning, please share this. You can share this on Facebook. We want to make sure to get this out to anyone who may benefit from it. It is a free webinar. We're so thankful to have Dr. Saunders with us. As you can see, he's full of information, and I just really appreciate him. I love that he's always trying to get to the cause of things and to take care of things naturally. Medicine is great, but it doesn't always have to be our first option. So make sure you share this on Facebook. You can also go to bartonwebinar.com. There you will find a link to our YouTube channel, and be sure to subscribe to that. You'll get a notification anytime we upload a new webinar, and you'll be able to check the library out. We have so many topics that we've covered over the course of nearly a year. We've been doing this for almost a year, every single week. And so we have listened to all of the questions from our customers and picked topics based on the things that they wanted to learn more about. So it's a great library for you guys to get more information. So feel free to post some questions today. We will probably take a few more. But again, bartonwebinar.com. If you're on Facebook, I posted that. And then I'm going to actually post it in the Zoom channel here. So if you need that information, sorry, my husband just came in here and turned my ring light on me. There we go. But yes, let's go back. Let's get to some more questions. So post those in the chat. Let's see what else do we have. Oh, this is good. Well, not good. Grace says she has a cyst on her hand, a ganglion cyst on the top side. Is there any way to get rid of it naturally?
Good question. Okay, ganglion cysts, they usually show up right here on the wrist. And it's because all of our joints have a membrane around them that contains the fluid inside, the joint fluid, that's actually more like a gel that lubricates the joints. And what happens in the wrist is because there's so many bones, there's 7 bones in there, that occasionally between one of the bones, that membrane will pop through the top and form this cyst on the top. So what the surgeons generally do is they'll put a big needle in there, like an 18 gauge needle, and suck the fluid out, and then the membrane will suck back down into the joint. And 50% of the time it won't come back. It'll be gone for good. Occasionally, if it's a recurrent one, they'll have to actually cut open the skin and open it up and tie off the cyst and then take the cyst out. That's sometimes needs to be done. So the natural way of doing it is the old way. Before they had needles to put in there and surgery to remove them, what they used to do, they called them book cysts. They put your wrist down on the table, and they take the fattest book they can find, and they go whack, and and they pop the cyst. And then the gel squirts out into the tissues, it gets reabsorbed, and the membrane sucks back into the joint. And 50% of the time it doesn't come back. So some people still call them book cysts, but yeah, that's the natural way of getting rid of them.
Wow. All right. Sounds like we could probably search some YouTube videos and find people doing that, I guess.
I'll bet you can find it.
I am a fan. You know, some people enjoy watching like Dr. Pimple Popper. If you've ever watched any of those videos, I kind of enjoy that. So
That
I think
is
you either
funny.
love that kind of stuff or you very much dislike it. And I don't mind it. It's kind of fun. Okay.
You should be a dermatologist.
I know. I think I would enjoy it. Okay, so this is from Claire. I take glucosamine HCI 1500 milligrams with chondroitin MSM complex 1103. Okay, 1103 milligrams, one in the morning, one in the evening. Apparently it is compared to Osteobiflex. Does this sound okay?
Yeah, that's fine. You know, like I said, all of those are completely non-toxic. So, if you're taking vitamin C, 1,000 milligrams 3 times a day, that's not going to be any better or worse than taking, 500 3 times a day. It was just that the people thought that they could just, put it all together and take it once a day. But it turns out that if you have joint pain, you may be better off, and you can test it, do a beta testing. A/B testing, see if one works better than another. But generally the rule is 3 times a day. And so, and a lot of the formulas were 500 milligrams of each, taken 3 times a day. But yeah, that formula is fine. More is not worse. It's okay.
Okay, from Krish, does the diabetes reversal kit address the needs of vegetarians? And if not, will you be including this aspect in future updates?
As a matter of fact, Krish, we have been talking about that. We have been talking about having the vegan vegetarian option on the in our meetings as part of a dietary or what do you call it? Our book on a recipe book.
Yes.
Where we have that, and so we have a definite vegan options. See, part of the reason for that is most people think of a ketogenic diet or a 30-gram carbohydrate diet. There's no way you can do that in a vegan way because how are you going to get enough nutrition when every fruit and vegetable has some carbs in it? So, you get one orange and you've used up your entire day's supply of carbs. And you can't live on one orange a day. No, you can't, but you have a lot of free things like spinach and broccoli and asparagus and cauliflower and Brussels sprouts. And there's a lot of things that are free that even though they're 100% carbs, since it's all or mostly fiber, that you could live on those kinds of things and still have a vegan diet and be ketogenic.
Okay, awesome.
You don't have to take spoonfuls of coconut oil, which some people do.
Or they add it to their coffee.
Yeah.
Okay. Let's see. Could you please repeat the name of the book recommended? The one that I had mentioned was "Heal Your Body" by, I believe it was Louise Hay. Is that right?
Right, Louise Hay. Hay. And the other one is Dr. Sarno, John Sarno, M.D. And that is Sarno, Sarno. And he wrote a series of books, and The Divided Mind was, I don't know, you may have to read the series, but Mind Over Back Pain, he revised it and improved it. And he talks about things like fibromyalgia and arthritis as also parts of this problem where you get a lack of blood flow.
Okay. You know what? The reason we even had this topic is because it came up in a question from a customer. And so I'm going to read that question and I'll let Dr. Saunders answer. Well, actually, you know what? I think you actually probably did answer it. Yep, you already did. But I'll read to you what she had asked. And he actually gave her the same recommendation for those supplements as he gave all of you today on the call. So let's see. The question is concerning a 57-year-old male who has never had any meds or medical ailments, but lately has been having stiff joints. He stopped drinking soda, caffeine, and aspartame, but was wondering if we had a recommendation for joint support. And so Dr. Saunders had given him the exact same recommendation, I believe, with glucosamine, MSM, and the vitamin C. And what was the other? There was something else. And let's see, I think he wanted us to address, the thyroid in our metabolism and diabetes as well.
Okay.
What is the role of the thyroid?
Okay. Can we do the thyroid on another day and do finish the joints today?
Yep. Actually, that'd be another great topic for us to discuss.
Yeah, because that's a big topic and it's going to take a long time and we really only have a few minutes.
Yep.
So the other part of when you have diabetes, you often have more inflammation. And the reason for that is the metabolism. You have more cellular distress. And cellular distress causes the cells to release what we call inflammatory mediators. They're like help signals, like your cells are calling 911. I need help, I need help, I need help. So when you have diabetes and you have a lot of those help signals going off all the time, then you get things like joint pains and fibromyalgia, and you're more likely to get problems with the blood flow problems and all of that. So diabetes is at least indirectly connected to this the arthritis kinds of problems. One of the ways that can help a lot is to balance those inflammatory mediators. And so especially people who are doing the diabetes reversal program and they're trying to do 20 grams of carbs a day and they're getting a lot of extra fats. And if they're getting a lot of vegetable oils, omega-6 oils, something like corn oil, soy oil, canola oil, they have like a 30-to-1 ratio of omega-6 that causes inflammation to omega-3, which suppresses inflammation. So if you're getting more oils in your diet and you find you're getting more inflammation or something, many studies have shown that adding omega-3 oils can improve your joint function, that the inflammation in your joints can actually diminish and go away, and so you don't have joint pain anymore. But remember, there's one other way. You know, we're a society of more. And just add more of this and add more of that. You know, I'm telling you, more glucosamine, more chondroitin, more vitamin C. And now I'm telling you more omega-3 oils, fish oil, flaxseed oil, walnut oil. But consider the other side too, that if you have less of all of the vegetable oils like canola oil, corn oil, soy oil, getting less of those is a great way of improving your function without adding more oils and and by decreasing the inflammation. So balancing has two ways to do it. If you're imbalanced like this, you can bring this up or you can bring this down. And so consider that, or both somewhat. But consider that when you're thinking about your ketogenic or phase 1 of the program, and you're getting this extra oil. Consider that you may want to do, like, I don't know, if you're eating meats, grass-fed meats will have more omega-3 and less omega-6. Be careful of like salad dressings. You know, you're having a lot of salads and it's okay to put oil in the salads. And the salad dressings, you know, okay, this one doesn't have any sugar in it, but then look at the oil. And a lot of times it's canola oil. In fact, I went through, at my local grocery store, I went through all of the salad dressings and I couldn't find a single one that wasn't mostly canola oil. So then I went to a natural food store and found some with avocado oil. And my wife goes, okay, we're getting those. And they were really good. So she went back and she bought cases of them. So we have in our cupboards, we have cases of this salad dressing with avocado oil. It's pretty good. Anyway, so avocado oil is okay, grapeseed oil, walnut oil, of course. You have to be careful with flaxseed oil because it has to be in the refrigerator. It oxidizes pretty quickly. But olive oil is great, and be careful of olive oil because they often mix it. If it says deodorized, that means it's mostly canola oil with a little bit of olive oil. And so you have to be careful with that it's 100% pure, and when you smell it, it has to smell like olives. When you taste it, it has to taste like olives. If it doesn't, then it's probably not real. In fact, a lot of the Italian oils, the really expensive Italian oils, were found to be mostly canola oil with a little bit of olive oil in them. And there were like 2 brands that were 100% when tested, 100% olive oil, and one of them was the Costco Kirtland brand. So everybody says, "Oh, Costco's cheap stuff." I don't know. Every time they test that, the joint formula that was tested at Costco was absolutely right on. You know, had the right amounts of everything, just like the bottle said. So I don't know. I've when tested so far, I've seen Costco come out okay. So
Hey, that's good.
there you go.
There's a couple questions I'm hoping we could do really quickly, if that's all
Okay.
right. Patrick had a doctor appointment on Friday the 26th. Since May 29th, he is down 12 pounds. His A1C is down 2.5. It's still high, but he's moving in the right direction. And is that a good drop for 28 days?
Oh my gosh, Patrick, that's amazing.
That is amazing.
2.5? That's like going from 10 to 8. That's awesome. Or you know, because people are usually, and when they're really bad, you know, they're 10, 11, you know, somewhere up there. When they're okay, you know, 7, 6, but to drop 2.5 points, that's amazing. Good work. Good
Awesome.
work.
He had also asked, is metformin a kind of salt? When I toss my meds in my mouth before washing them down with water, I taste saltiness.
Yeah, metformin, the hydrochloride, the HCl is, yeah, it's a salt. Yeah, interesting.
This will be our last question here. Let's see. I'm a diabetic, and in the last couple of weeks, I've had problems with my right eye, and I can't see well with it. Sort of a cloud on the eye. Is this curable?
Well, you have to ask the question why. If it's dryness of your eyes and you don't have the tears aren't, either the tears aren't working or the glands around your eyelids aren't creating the oil. The eye is amazing. You know, just to study the eye, you would have to believe in God. There's nobody who could study the eye and not believe in God, I swear, because it is so amazing. So you have a layer of water covering your eye, and then your eyelids have glands that make a layer of oil over the water so the water doesn't evaporate. So if you have that one of those layers isn't working right, if you have the oil layer but not the water layer, then you may have cloudiness of your vision, and especially if it's only in one eye, or if it's not enough tears to wash out the the proteinaceous material and stuff into your nose, and that when you blow your nose, you know, you think the boogers are coming from like your nose and stuff. Most of it usually comes from your eye. Your eyes are constantly draining into your nose, and then the proteins from your and oils from your tears are what creates that. So anyway, that's one possibility. Another possibility would be something internal to the eye, something like if you had glaucoma or cataracts or something else that could obscure your vision. So it would be a really good idea if you have blurred vision to see an ophthalmologist. They can test the pressure, they can test your glands, they can look at see if your cornea is worn away, anything like that. They would be able to see it and tell you what it is.
Okay. Okay. I think that's good. Anything you want to say to wrap us up?
No.
No. Well, there you have it, folks. No, you guys, there are more questions. And so please, please, please come back next week and ask us those questions. Just post them in there right away. We want to get to as many as we can. So again, you can find more information at bartonwebinar.com. That'll give you a link to supplements that we offer, our diabetes solution kit, our webinars, how to get onto the 610 Reset Facebook page. Everything is at bartonwebinar.com. And so actually I'm going to post that right there for you guys to go ahead and click on that link. So that's it for today. You guys are awesome. Thanks again. Thank you, Dr. Saunders. We always enjoy learning from you.
I enjoy it. Thank you.
Soon.
Bye.
Bye.
Bye.